Okay, everybody, are you ready?
Ready.
This, this is going to be one of the most significant programs I've ever done in my third-year career, and I'm glad you all get to learn about what we're going to talk about tonight. What I'm going to be discussing is iodine and how it affects the body. There's a lot of misinformation about iodine. You have a tremendous set of notes. This is from a book summary that I did on a book called Iodine, Why You Need It, by Dr. David Brownstein. Excellent book, excellent book. Changed my whole concept of what iodine is and how it affects the body. I'm going to read some of this to you, not to be redundant, and then we'll talk. Iodine is an element, not only for the thyroid gland. See, everybody thinks that iodine is just for the thyroid gland. It's not. It's for every cell inside of the body. It's in a group in that periodic chart. So I'm going to encourage you all to go to the internet, go to your favorite server, search engine, and type in the word periodic chart. Periodic chart. And on the far right, there's a column that's the halide group that has bromine, fluorine, chlorine, and iodine. Bromine, fluorine, chlorine, and iodine. I have that written down there for you. Now, what's so significant today is we don't realize, but iodine is good for antibacterial, antiviral, antiparasitic, which is very common, 80 million Americans, and it has anti-cancer properties. Now, we live in a very iodine deficient society. 1.5 billion people, that means anywhere you're watching me in the whole world right now, 1.5 billion people in the world, they estimate, are deficient in iodine. Iodine deficiency can result in mental retardation. It's probably one of the leading causes of brain dysfunction. It can also result in goiter, which is an alteration of the thyroid gland, and infertility. So if you're watching me right now, if you may have grandchildren or just children that can't have babies, they need to be tested to make sure they have enough iodine. Watch and listen to these following conditions that can be caused by an iodine deficiency. Atherosclerosis, which is fattening around the blood vessels in the body. Probably what my biggest concern is, one of the reasons I wrote Dr. Bob's Drugless Guide to Balancing Female Hormones, is breast disease. Another one is Dupuytren contracture. And what happens is that there's actually a contracture to the muscles in your hand. Excessive mucus production. I have people that come in, they're always coughing, and there's always this mucus in their body. If you are coughing, a lot of mucus in your body, and you have cold hands and cold feet, it's a sign to me you might have a need for iodine. Fatigue, tired, fibrocystic disease, hemorrhoids. Now you can say, oh, Dr. Bob, what does iodine have to do with hemorrhoids? I know you're thinking that, Marcia. When you don't have enough iodine, you probably have a low thyroid. When you have a low thyroid, the thyroid gland is one of the leading causes of constipation. And when you have constipation, you're going to bear down, guess what you're going to get? Hemorrhoids. Okay? Infections. Keloids. Keloids are excessive scarring in the body. Liver disease. Very common. If you're constipated, you're going to have liver disease. And what's really significant is ovarian disease. Ovarian issues. Parotid duct stones. Those right here, this is a parotid gland. Your parotid gland has to do with digestion. Peyronie's. And I'm not saying this to be silly, but Peyronie's is the name of a condition. When the man gets an erection, there's a bend in his penis. Now, and I've had people that I've consulted with around the world that have that as a problem. And if we could help that without surgery, that'd be tremendous. Prostate disorders, sebaceous cysts, thyroid disorders, and vaginal infections. You say, Dr. Bob, that's a lot. Trust me, it is a lot. And I can tell you that I've had many patients that we've helped with every one of these conditions just by adding iodine. I had a gentleman recently, for 2 months, he had a chronic sinus infection. He'd been to his family doctor, he's been to his natural doctor. We did a thyroid test to him, his thyroid levels were all low, we gave him iodine, and guess what happened to his infection? That with the spinal correction, it cleared up. So iodine has natural abilities to get rid of bacteria and viruses in your body. So where is it found? It's found in seawater. In our practice, we use Celtic sea salt. Celtic sea salt, sea vegetables. So back in the old days, they used to call it seaweed. Well, it's not seaweed anymore. Macrobiotic diet, it's sea vegetables. You can sprinkle that on your salad. Mixed green salad. Some people, there's another item called dulse. Anything that comes from the ocean would have iodine in it. It's not readily available on the earth crust. It's not readily available. You're going to go in your backyard and you're going to grow your plants and think you have iodine in it. But that's not the case, and that's why it's very serious. Iodine is found in every cell of the body, the thyroid gland being the most common gland, the thyroid gland. It's found in the salivary glands, gastric mucosa, breast, ovaries, eye, and it can result, if you don't have enough, spontaneous miscarriage in the body. So I have ladies that will come in that can't get pregnant, and then once they do get pregnant, when that occurs, what's going to happen to them is they could have a miscarriage. It was discovered in 1811 by this gentleman, by Bernard Curtios, and he was making gunpowder. And he was making gunpowder, he was really close to the solution that turned the product purple. That's why he called it iodine, and iodine is a Greek term which means violet. It was the first agent used to treat a condition, which is goiter. Iodine is not common in general foods, but it's common in seafoods. I have some items here that I'd like to show you. Some of you maybe use iodized salt. We really prefer our patients to use Celtic sea salt. Iodized salt, sodium chloride, what I just showed you, has chlorine in it. You don't want to use sodium chloride. Iodine is added to table salt as 100 parts per million in the form of potassium iodide. It's estimated that 50% of the population, 50% of the population don't use enough iodized salt. See, a lot of people stay away from using salt today because they're afraid of their blood pressure. So we encourage our patients to use Celtic sea salt. They add iodine today to animal feed. So there's a small amount of iodine in iodized salt, which I'm going to explain to you in a minute. We don't have enough, though, in the iodized salt to supply all the cells inside of the body. Your thyroid gland needs iodine. Thyroid gland needs iodide, specifically. Your breast, your ovaries, prostate need iodine. That's why we use a product that has a combination of both of them in it. It's a high-potency iodine called Iodine, and we also use a lower whole food iodine that's available on our webpage. Pregnant women are very commonly deficient in iodine. The RDA for iodine was set up to prevent goiter in the thyroid gland. Iodine used to be used in bread. They replaced iodine in bread with bromine in the 1860s. But I have in this container right now, which I have it covered in this plastic bag because it's really smelly, this is bromine. Bromine in a hot tub, bromine in a pool is antagonistic to iodine. Iodine versus iodide. Iodide is the reduced version of iodine. There's an electron added to iodine which makes it a salt, hence they use the word potassium iodide. Iodine is hard to get into a solution. It's been thought that iodine is easily converted to iodide in the intestines, and it is not easily converted. We're going to stop that.
So how do I stop? I don't hit record.